Hi, I'm Dr. Noreen Himani. I'm a practicing dentist since 14 years in Mumbai, and I have a lot of patients who visit me and have a lot of fear and questions regarding teeth cleaning. So today through this video, I'm going to try and answer these questions which I'm sure a lot of you have regarding teeth cleaning. So the first question commonly asked by patients is that, doctor, if I get my teeth cleaning done, are my teeth going to become loose and thin? So generally, people feel that after teeth cleaning that the teeth are going to become loose, and some of them also feel that the teeth are going to get worn off, or we are going to rub their teeth or things like that. So firstly, let me tell you that teeth cleaning is an extremely safe procedure, and it does not cause any kind of loosening or any kind of wearing off of your teeth. Why do people feel that teeth become loose after cleaning? So what happens is, what do we do in teeth cleaning? So we basically clean off all the hard deposits that are formed around your tooth surface and on your tooth surface, specifically between the gums and the tooth. So we clean all that off, and we remove those deposits off. Now what happens is, if since many years you have not got your teeth cleaning done, then these deposits they form like a full thick band. Now the gums and the bone inside has already got depleted, and one fine day after the age of 60 or 70 years, if you decide to go for cleaning for the first time, then this band is so strong that the moment this band breaks, the inside teeth were already shaking, but they were held up by this band. Now that this band is off, suddenly the person starts feeling that the teeth have got loose because of cleaning. But for all other people, teeth cleaning cannot cause movement in your teeth. So please get rid of that misconception. The second question was that, will my teeth become thin? Some people even ask us questions like, will my enamel get worn off? So I'd like to tell you all that teeth cleaning is done using a technology which is an ultrasonic vibrator. This is not a tooth drill. Okay, this cannot drill your tooth. It cannot rub off enamel from your tooth. It's a mild vibrator which is just probably a little stronger version of your toothbrush. These deposits cannot be cleaned by you at home using your toothbrush. They need to be professionally cleaned using this vibrator, and this vibrator cannot wear off your enamel. So no, your teeth do not become thin after teeth cleaning. The next most common question that people feel and ask is that, will I get sensitivity in my teeth after teeth cleaning? So teeth sensitivity is a temporary effect of teeth cleaning in some, not all patients. Because what happens is, all these years, or maybe once a year if you're doing your cleaning, your tooth surface is covered by this layer of tartar that we call it, the deposit. Your tooth is covered by it. The moment we remove that off, temporarily for 1 or 2 days, and for some people up to 7 days, there may be some sensitivity on having extremely hot, extremely cold food, but that gradually wears off. So it's a very temporary effect and can be taken care by the use of sensitivity toothpaste and things like that. So that's another misconception that we commonly asked. Now another thing that people generally feel after cleaning is the tooth surface starts feeling very rough. So a lot of patients ask me, why do my teeth feel rough after I get teeth cleaning done? Now what happens is, teeth cleaning sometimes is not just a one sitting procedure, because those deposits that are there on your tooth, we remove them off part by part using the vibrator so that we do not harm your tooth. Now when those deposits are taken off, if some portion of the deposit remains on your tooth surface for a few days until you get your subsequent sittings of teeth cleaning, followed by a session of polishing done, the tooth surface may feel a little rough. Once your teeth cleaning is completed and the polishing is done, the roughness wears off. Again, that is a temporary phenomena, and it wears off immediately, subsequently. Now, one other favorite question of patients while considering teeth cleaning is that, why is there bleeding, doctor? I am scared of the sight of blood. Now, again, these deposits or tartar that we call it is a kind of an infection in your mouth. whenever there is an infection, it leads to some amount of swelling in the gums around, because these deposits get deposited between the tooth and the gums. So this is where they get deposited. So because your gums are around it, they tend to swell up because of this infection. Now whenever something is swollen, the moment we apply gentle pressure also to it, it tends to bleed. So that's a response because of the infection. Once your teeth cleaning is completed, then after that, even if you force with a lot of brush, you will not see bleeding. So bleeding is because of the inflammation of the gums around the tooth when there is a deposit of tartar over there. As soon as that goes off, your gums become healthy, the swelling goes away, and so does the bleeding. So it's a temporary thing. Now one more thing that people generally feel and so are scared to do teeth cleaning is that they feel that after I got my teeth cleaning done, now there are gaps between my teeth, those triangular gaps between the teeth. So let me tell you again that these gaps have always been there, okay, just that they were filled up with this tartar or calculus. The moment the dentist takes it off, you start feeling that the dentist has created those gaps. But dear friends, that's not so. The moment this tartar basically increases at the expense of eating up your bone and your gums. So it gradually increases and fills up those spaces which should have been occupied by gums and bone. If you do not get your cleaning done, this gap or this gums and the bone is going to deplete further, and tartar is going to fill up those spaces. And the moment it is taken away, either naturally, sometimes it breaks. Many of you may have realized that something hard just broke off and now you feel a gap. So this tartar, when it becomes too much, it even breaks off on its own. Or if you get a cleaning done by the dentist, you start feeling that the gaps have been created, the gaps have already been there, and if you do not get your cleaning done regularly, these gaps are going to increase. So the dentist isn't causing the gaps between your teeth, they have always been there. Alright, now so these were the questions related to the procedure. Now some other questions is that how much time does it take to get teeth cleaning done. So teeth cleaning is firstly a very painless procedure, there's no pain involved in it. Secondly, one sitting is generally of 20 to 25 minutes. Now depending on each one's oral health status, now suppose somebody is used to drinking a lot of tea, coffee, and also has habits like smoking or pan chewing or tobacco chewing, in that case there are a lot of stains that are there on the tooth surface. So to clean them, it may take multiple visits, okay. So one sitting is of around 15 to 20 minutes, because more than that it is difficult for anybody to keep their mouth open. So depending on how bad the situation is, there may be 2, 3 and up to 4 sittings involved. So that's about the teeth cleaning. Another misconception that I'd like to clear over here is that people feel that after teeth cleaning, their teeth are going to become white. So let me tell you, teeth cleaning and teeth whitening are two very different procedures. Teeth cleaning basically is for your gum health, just like we do facial for our skin. Similarly, we do teeth cleaning to keep our gums healthy and strong so that they can support the teeth for a longer duration, and so we won't end up losing our teeth until we grow much older. So that's now for people who have deposits, like who chew pan or who have tobacco chewing habits or who smoke, once these deposits are taken off from your tooth, yes, the teeth may look a little brighter and the stains will go off, but teeth cleaning cannot enhance the base color of your tooth. For that you need to undergo a procedure which is called as teeth whitening, which I will cover up in my future videos, so stay tuned for it. And this was my attempt to help you understand the misconceptions about teeth cleaning. So thanks a lot.